So in today's class we will discuss about COVID-19 and signs and symptoms of COVID-19 with the nursing interventions of patients with COVID-19. So we know that COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This new virus disease were known before the outbreak began in Wuhan, China in the year December 2019. So it is a pandemic condition affecting many people globally. Signs and symptoms of COVID-19. So, the most common symptoms of COVID-19 are loss of smell, loss of taste, red eyes, and rashes. Along with that, we can see fever, cough, fatigue, shortness of breath, muscle or joint pain, sore throat, headache, chills, nausea, vomiting, nasal congestion, diarrhea, hemoptysis, and conjunctival congestion. So, the most common symptoms of COVID-19 is like that are loss of smell, loss of taste, red eyes, and rashes. So in nursing role, first nursing assessment is very important in identifying the signs and symptoms of COVID-19. So careful assessment is essential in the evaluation and management of patients who have COVID-19 and especially those with fever, acute respiratory illness and other symptoms of infection. So in nursing assessment of these patients with fever, acute respiratory illness and other symptoms of infection, we have to include the travel history of the patient, and at the same time in physical examination we have to document the patient's signs and symptoms which may develop 2 to 14 days after exposure to the virus. So the signs and symptoms of COVID-19 we have already seen. So the major signs and symptoms are loss of smell, loss of taste, red eyes and rashes. Along with that, fever, cough, fatigue, shortness of breath, muscle or joint pain, sore throat, headache, chills, nausea, vomiting, nasal congestion, diarrhea, hemoptysis and conjunctival congestion. And so based on these signs and symptoms, we have to frame the nursing diagnosis. So it provides the clinical judgment about patient's experience. So there will be possible exposure to the virus that causes COVID-19 and we have to include the patient's level of knowledge about the transmission of COVID-19 and definitely patient will be having fever, hypothermia and impaired breathing pattern will be there related to shortness of breath and definitely patient may express the feeling of anxiety associated with the unknown etiology of the disease. So we'll see what are the nursing interventions based on the assessment data. So based on our assessment, nursing next important points we have to focus in COVID-19 is the nursing interventions that we have to provide based on the assessment. So based on the assessment, we have to focus on monitoring the vital signs. So we know that the main symptoms of COVID-19. So definitely patient may have respiratory symptoms and even temperature variations will be there. So we have to monitor the temperature and respiratory rate of the patient and we have to monitor next the oxygen saturation because normal oxygen saturation after measuring it should be 94 or higher. So patient with severe COVID-19 symptoms can develop hypoxia. So it is important to monitor the oxygen saturation of the patient and next as the patient may show the signs of hyperthermia, we have to manage fever by using appropriate therapy for hyperthermia. Like for example, we can eliminate excess clothing and covers and we can use cooling mattress by applying cold packs to the major blood vessels and even we can start with increasing intravenous IV fluids and administering antipyretic medications and at the same time we have to adjust with oxygen therapy in the event of respiratory problems. Okay, so these are the some of the nursing interventions and next major role of nurse is to maintain respiratory isolation. So isolation rooms should be well marked with limited access. All who enter the restricted access room should use personal protective equipment such as mask and gown. That is very important. We have to maintain strict respiratory isolation and we know that hand hygiene, enforce strict hand hygiene. We have to educate the family members to prevent transmission of coronavirus. Patients should wash hands after coughing and should all who enter or leave the room. So all who is taking care of the patient, and the patient also should enforce strict and hygiene and provide information to the patient. That is, health education should be provided to the patient how to protect oneself and one's family from coronavirus.